why do people stop psychiatric meds? And to a broader audience, why do people stop meds in general, therapeutic medications? Number one reason is side effects. They stop the medication because they have side effects. The big ones I see, well, this medicine is causing me to eat more to gain weight. That's a big one. I'm very sympathetic towards that, and I try and switch the medicines around. That's a major one. The next one would be sexual drive. Can't have an orgasm, can't have ejaculation, can't have an erection, lack of desire. A lot of medicines cause these problems, especially psychiatric medicines. Most notably, the SSRIs, Prozac, Paxil, Zoloft, Luvox, Alexa, Lexapro, Effexor, Pristiq, blah, 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 blah. The SSRIs, SSNRIs decrease sexual drive. They affect sexual functioning, orgasm, drowsiness. These are the big ones. That you feel tired. You won't want to take a medicine where you feel lethargic all day. Some people stop medicine and just feel weird on it. I get it, but I would say instead of stopping, try and get to something that works better. Another one is level of alertness. You can't concentrate, word finding problems. Those are the 5 or 6 biggest ones, but medicines can have a lot of side effects. Nausea, vomiting, diarrhea, tremor. Senses are altered, visual, auditory, smell, dry mouth. Those are all side effects, constipation, that get in the way of people taking medicines, and I try and work around them. Usually I can. Another reason people stop taking medicines, get this statistic. Once a day, people are like 70% compliant, 80%. If you give a medicine twice a day, half the people don't take it. Once you're at 3 times per day, 80% of people won't take the medicine correctly. So that's like a doctor issue. The more you dose a medicine a day, the more likely someone is not to take it. Then there's the old, if I take a medicine, I'll be labeled. So I take an antidepressant, everyone will think I'm depressed. If I take an antipsychotic, everyone will think I'm psychotic. If I take this medicine for anxiety, everyone will think I have anxiety or I'm a drug addict, because those might be addicting, like Xanax, Ativan, and Klonopin, which that really is not a good reason to stop a medicine. You have an illness regardless of whether you take a medicine or not. So taking it does not mean you will be labeled. But that's what people think, and that's a big reason people stop. Another big reason people stop is poor insight into illness. I don't have a problem. I don't need to take medicine. But what that does is all the sequelae, all the secondary problems associated with the medication become a problem. Depression, anxiety, all the signs and symptoms of the illness are not treated, so that individual walks around impaired and unable to function because they're in denial of their illness. Oh, then this is a big one. I want to do it naturally. The natural remedies in psychiatry, like L-theanine for anxiety, works kind of okay. Hypericum with St. John's wort for depression, 5-HT, doesn't work that great. Melatonin might help you sleep, but none of these work as well as medication. They can help, but I would not say you could treat most depressive episodes, anxiety problems, or panic or psychosis with herbal remedies or homeopathic remedies. They can help. Another one is they're saying, well, I feel good now. I don't need the medicine. Well, the only reason you feel good is you took the medicine, so you're not going to take it, you're not going to feel good. So that logic does not work so well. Another one is, well, my recent girlfriend, significant other, boyfriend thinks I don't need it. That'll put the whammy on the medicine right away, they'll stop. Or if a coworker or a boss or a current friend or family members think you don't need it, you most likely will stop it. That's a huge one. So if people around you aren't supporting you taking it, the odds are you won't take it. It could be disastrous. I've seen that go bad. Oh, here's a good one. I get people telling me, well, I'm not taking medicine because there could be a reaction. I like drinking and drugging. That's a really bad reason not to take medicine. Stop the drinking and drugging. And a lot of people can't. So One of the biggest problems I run into, I would say half the medicines I use, people say, I just can't afford it. Insurance is not paying for it. It's too expensive. It's sad. You know, some of these medicines like Latuda, Caplyta, they're like $1,200, $1,000 a month. There's no way you could afford them. There's one medicine for migraines, Nortec, $105 a pill. So, I mean, that's very expensive, almost prohibitive. Another one is I don't like seeing doctors, so I can't keep my prescription going. That's a big one. The sad one that I see is someone says, why would I take medicine? I just don't care. So whatever happens to me, I don't care if I die or whatever happens. So what? And there's another one that I see, if I take the medicine, it's just masking my problem. I'm not really treating it, which is not the case. That assumes that there's just a thought or some magical behavior or some magical cure when there's not. So that doesn't work out either. So those are some of the things I run into in my practice with people and trying to take medicines. I hope that helped. I appreciate it if people would subscribe to my page, Agresti.com. And also you could go to my website where I have a blog, which I put a blog on every week at Agresti.com. So hit the notification bell, subscribe. Thank you.